Connected to challenging.
Okay, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. This is for press only, so if you are logged into the Zoom room and you're not a member of the press, you can log out and watch on one of our live streams, including on Gov TV, which is on Comcast channel 64 and 1164, as well as Verizon channels 40 and 41. And it is also on the Department of Public Health's Twitter account at PHL Public Health. And now we will turn things over to Mayor Kenny. Mayor, you have the floor.
Thanks, Mike, and good afternoon, everybody. As you know by now, the FDA's guidance to stop use of the Johnson vaccine has affected the city's extensive vaccination efforts. Dr. Farley will join us in a few minutes and we'll have more details on this occurrence. I do, though, want to make sure all Philadelphians are aware that we are strict about following this and all CDC guidance, as we have done throughout the course of the pandemic. I know this change is disappointing to many, particularly since J&J vaccine is one shot only. We are certainly sorry that some of you who may have had appointments today were inconvenienced. But this will not deter us from working aggressively to get every single Philadelphia resident vaccinated. Those clinics that have had to close because of the change will pivot quickly to the other vaccines and reopen as soon as possible. With that in mind, I'm pleased to announce that this week our clinics reached a huge milestone with our millionth dose of vaccine administered. We administered the first vaccine in late December, and since then we have seen the city and our community healthcare partners come together like never before. I'd like to thank Dr. Farley and his great team at the Department of Health, as well as the folks of the Office of Emergency Management, led by Commissioner Adam Teal. This milestone is also shared with FEMA, our state partners at PEMA, and the Pennsylvania Department of Health, and all our community and healthcare partners for their tireless work over the past year. 1 million doses is just 4.5 months is significant, and they all deserve credit. Philly is a city of partnerships. That's how we get things done, by working together. And of course, starting next Monday, April 19th, all Philadelphians will be eligible to get the vaccine. We are not done yet and won't stop until every Philadelphian who wants the vaccine receives it. But we need your help. So help spread the word about the importance of being vaccinated with your family, friends, and neighbors. Now, Dr. Farley.
Thank you very much, Mayor. As you've heard, there is a pause on use of Johnson & Johnson vaccine. I'm going to discuss what that means for Philadelphia. And with COVID case rates high, though, we still need to continue to vaccinate people as quickly as possible, especially those people over the age of 65. So I'll talk about that as well. First, though, the numbers on the epidemic. Since this time yesterday, we've identified 130 new cases of the COVID-19 infection diagnosed by the PCR test or the antigen test combined. Now, we did get a low number of test results today in from the laboratories, about 5,500. I wouldn't press too much on that particular daily number. For the past week that ended on April 11th, we averaged, or April 10th, we averaged 511 cases per day so far. Expect more with late reports. And of those people tested, 6.7% tested positive. Now compare that to the previous week, we were at 562 cases per day. So we're pretty stable compared to the last 2 weeks. Now in the United States as a whole, cases are stable, but they're rising quite a bit in some areas, including Michigan. The case rates are so high, the Centers for Disease Control director is recommending a shutdown to reduce spread. Now back here in Philadelphia, the number of patients that are hospitalized with COVID has continued to rise slightly. We were at 504 this morning. That's a small increase from the 490 this time last week. For deaths, we have 5 new deaths identified, bringing us to a total of 3,341 since the beginning of the epidemic. Now, we were averaging about 20 to 30 per week in late February and early March. As of the week of March 28th, we have 34 deaths to report. And unfortunately, I see this as a sign that we are likely to see an increase in deaths from here because the deaths do lag behind. And so they're likely matching up the increase in cases we've seen in the past few weeks. Now, let me turn to vaccination. Let's talk about Johnson & Johnson. There were 6 cases of a severe blood clotting problem that were diagnosed in people who had been given Johnson & Johnson vaccine. These are blood clots that occurred in the veins combined with low counts of what are called platelets. And their platelets are components of the blood that help the blood clot. All of those blood clotting events occurred in women who were between the ages of 18 and 48. And based upon that, the Food and Drug Administration and the CDC together recommended that all providers pause in the use of Johnson & Johnson vaccine until these problems could be further investigation. So we will follow that guidance here in Philadelphia. We will not be administering Johnson & Johnson vaccine in our facilities or recommending that other providers admit it at their facilities effective immediately until we get further notice from the federal government. Now, it's very important right here, though, to put this in perspective. These events are extraordinarily rare. There were 6 cases out of 6.8 million doses of Johnson & Johnson vaccine given in the United States. So that's about 1 event per million doses. Now, that risk is more than 1,000 times lower than the risk of serious infection from COVID-19. To put those numbers there, in this city of 1.2 million adults, we've already had 3,300 deaths from COVID-19. So that's 2,700 deaths per million adults. That means that anyone is much more likely to have a medical complication from COVID-19 than a medical complication from the Johnson & Johnson vaccine. Also, there's no reason to think that this problem is connected to the other vaccines that we're giving, not to connect it to the Pfizer vaccine and the Moderna vaccine. The Pfizer and Moderna vaccine use different technology. They're using what are called mRNA technology. They're mRNA vaccines. The Johnson & Johnson vaccine uses a technology called an adenovirus vector. You don't need to know what those terms are, but you can think of the mRNA vaccine as much simpler and much purer than the Johnson & Johnson vaccine, and maybe less likely to produce antibodies that were not directed against the coronavirus itself. Also, the Moderna vaccine and Pfizer vaccine have been given in this country so far with 190 million doses. 190 million doses have been administered without this problem having been seen with those doses. So we don't have any reason to think that this potential problem, which is potentially rare with the Johnson & Johnson vaccine, has any implication for the other vaccines. Let me talk about then our supply and our administration's vaccines in Philadelphia. Our supply for Pfizer and Moderna vaccine is unchanged. We're still getting about 40,000 first doses each week of the Pfizer and Moderna vaccine available to us here in the health department, or about 80,000 total when you count first doses and second doses. And we're told that that's about what we'll get each week for the next 3 weeks. That'll be enough for us to continue most vaccination services between that and what has been previously received. So how is vaccine being made available today? We're now up to 261 sites that are enrolled and receiving vaccine. That's up 14 from last week. That includes hospitals and clinics and pharmacies. We now have 46 independent pharmacies enrolled. That's up 3 from last week. We'll talk about our large vaccination sites and the implications for them. The Center City Vaccination Center at the Convention Center just finished its round of second doses of Pfizer vaccines yesterday. And before this event, we plan to change there from the Pfizer vaccine to the Johnson & Johnson vaccine today. Instead, what we'll do is we'll continue the use of Pfizer vaccine, just have administering first doses starting today. It'll be in operation today from noon to 4 p.m. And we'll schedule to continue for 2 more weeks like that. Now, the site was initially scheduled to continue for 2 more weeks, but we are requesting that the site be extended for 4 additional weeks, which would then bring us to 6 additional weeks from here. That would give us enough time for 3 weeks of the Pfizer vaccine first doses and 3 weeks of the Pfizer vaccine second doses. What about our federally supported type 2 vaccination site at Esperanza in Hunting Park? That site vaccinated about 2,000 people per day over the weekend and about 1,100 people yesterday. And that site vaccinated a very diverse population. Only about 15% of the people that they vaccinated there were white, and about 55% were Hispanic. Now, that site has been using the Johnson & Johnson vaccine, and it planned to change to the Pfizer vaccine this coming Saturday. Instead, that site will close today. The patients who are scheduled today will be rescheduled, and then it'll tomorrow reopen to provide Pfizer vaccine. They'll do 3 weeks of the first dose and 3 weeks of the second dose. That's at least 1,000 doses per day. Now, the hours of this clinic change day to day. We're moving them around so that people who work different schedules will have different opportunities to be vaccinated. And tomorrow that site will be open from noon to 8 p.m. Now, we will have to curtail some of the clinics where we plan to use Johnson & Johnson until further plans can be arranged. For example, we have neighborhood clinics operated by the fire department and the Office of Emergency Management. One was scheduled today, one was scheduled Monday at 7800 Ogons Avenue in the Northwest. One was scheduled Friday, the 16th, at the Salvation Army in West Philadelphia. Those are going to be canceled until we can make other arrangements. In addition, there were some other individual, what we're calling pop-up clinics, where either the health department or the fire department was going to, say, a church and providing vaccination on a single day with Johnson & Johnson. Those likewise are going to be canceled until we can figure out how to reschedule them using other vaccines or until the guidance about Johnson & Johnson vaccine changes. Let me back up and talk about how successful we've been with vaccination so far. In general, vaccinations have been happening very quickly in the past few weeks. For the week ending April 4th, all the providers in the Philadelphia combined delivered 119,000 doses. And for the week ending April 11th, they administered 120,000 doses so far. We know that there's more data we have yet to take in, and so that number will rise when it gets more complete. Now, this growth in the number of doses administered is in large part because of the growth in pharmacies. Pharmacies are now the number one source for vaccination in the city. As of Monday evening, across all providers, there was delivery of 612,000 first doses. So 612,000 people now have received at least one dose from Philadelphia providers, and 398,000 people were fully vaccinated. As the mayor said, those providers will deliver their 1 millionth dose today, which is really quite an achievement. Now, we know that about 27% of Philadelphia residents have had at least one dose, and that's an underestimate because that does not count Philadelphia residents who were vaccinated outside of the city. In our data, which only represents the administrations that were done by the city of Philadelphia, 17.5% of Philadelphia residents are fully vaccinated. In the CDC's data, where they include Philadelphia residents vaccinated elsewhere, it's at 20.8%. And of the people over the age of 65, in the CDC data, 45% are fully vaccinated. Now, we need to increase that number. We want to boost particular the people over the age of 65 who are fully vaccinated because they represent 80% of the deaths occur in people over the age of 65. So we really want to protect those people. Let me talk a little bit about eligibility. Yesterday, we made everyone in our Phase 1C eligible. That includes people over the age of 65, people with high-risk medical conditions, people who are essential workers of all types, unpaid caregivers of medically vulnerable people, and people who are receiving home and community-based services as defined by the State Department of Human Services. Now, the Commonwealth of Pennsylvania announced yesterday that they're going to be moving to Phase 2 today. Philadelphia will move to Phase 2 this coming Monday, April 19th. That's consistent with what the president requested that we do, and that's what we announced last week. We do want to let people who are over the age of 65 have a few more days to get vaccinated before they have to compete with all the other people that are under age 65 and don't have medical conditions. But if you are under the age of 65 and you don't qualify right now, it's not too early to start scheduling your appointment for next week. I would suggest interested people start doing that now. But for people over the age of 65, we do really want to stress how important it is to be vaccinated now, as soon as possible. Don't delay because the COVID case rates are so high. As I said last week, federally qualified health centers are providing walk-up access to people over the age of 65, and 3 of our city health centers are doing that. They're calling this Walk-Up Wednesdays. So Wednesdays from 8 to 4 o'clock, people can walk up who are over the age of 65 without an appointment and get vaccinated. We will continue that this week, only now with a switch, we will be using Moderna vaccine instead of Johnson & Johnson. So that occurs at our Health Center 3 Annex at 4219 Chester Avenue in West Philadelphia, Health Center 5 Annex at 2001 West Burke Street in North Philadelphia, and at Health Center 10 at 2230 Cotman Avenue in Northeast Philadelphia. Last week, we announced this, and about 200 people over the age of 65 walked in. That's great. We'd like to have that, as many or more this week. So in general, what should people do who want to get vaccinated? You can go to our website, www.phila.gov/vaccineinterest. and put in your name in our database, and you'll get called soon to be invited. Or if you don't have internet access, call 311, and they'll sign you up for you. Or you can go to the websites of pharmacies or hospitals and clinics that have their own online signups. There are appointments available in most of these providers now. Let me talk a little bit about transportation, because I know for some people, transportation is a barrier to accessing at least our mass vaccination sites. Both the Pennsylvania Convention Center and the Esperanza site are accessible by public transit. And in addition, there is free CCT services for people over the age of 65 or with disabilities to access those sites. So if anyone needs that sort of help and they're over 65 with disabilities, call 311 and select option 5 at least 72 hours before your appointment. And then you can get a CCT service to attend, to get transportation to one of those mass vaccination sites. In addition, the city is helping to coordinate shuttle buses that are organized by churches or the community-based organizations. So if you are a church or a community organization and you want to organize a group visit to one of our mass vaccination sites, just send an email to oem@phila.gov. That's OEM for Office of Emergency Management @phila.gov. And someone will talk to you and help you coordinate that shuttle bus coming to this mass vaccination sites. In addition, for the Esperanza site specifically, the Esperanza site in North Philadelphia is on bus routes for the 47 bus and the 53 bus. In addition, it's not far from the Broad Street subway, not far from the Hunting Park stop or the Allegheny stop. And there's a free shuttle bus from the Allegheny stop that is running in a continuous loop whenever the clinic is open. So if you need transportation from those subway stops, go to the Allegheny stop and just pick up that shuttle bus. And there's more details on all of our transportation options in our press release. We would appreciate the press getting that out there, make it easy for people to get transportation to these sites. So just to back up, what should people do right now about the epidemic? Well, I have seen with my own eyes, and also we see in our data that people are increasingly out of their homes, they're traveling out and around, and potentially in contact with more people. And I'm increasingly concerned that people believe that this epidemic is finished. If you think this epidemic is over, you are mistaken. This isn't over yet. COVID-19 epidemic is still here, and it is still deadly. At a global level, our epidemic is actually approaching the highest case count ever. So please, please, wear a mask. Wear a mask consistently, keeping it over your nose and mouth. Keep your distance from others and avoid being around others if it's at all possible. And as soon as it's your turn, get vaccinated. And all of our information is at our website, www.phila.gov/COVID. Thank you.
Thank you, Dr. Farley. And now for the Spanish language translations of the mayor's and Dr. Farley's comments, we go to Armando.
Palabras del alcalde Jim Kenney para el día 13 de abril del 2021. Buenas tardes a todos. Como ya se sabe, la guía de la FDA para suspender el uso de la vacuna de Johnson Johnson ha afectado los ambiciosos esfuerzos de vacunación en la ciudad. El Dr. Farley nos ha hablado hace unos minutos en inglés y les vamos a dar más detalles al respecto en español. Sin embargo, quiero asegurarme de que todos los habitantes de Filadelfia sepan que somos estrictos en cuanto al cumplimiento de esta y de todas las directrices de los Centros de Control de Enfermedades, como lo hemos venido haciendo hasta ahora en el transcurso de esta pandemia. Sé que este cambio es decepcionante para muchos, especialmente porque la vacuna de Johnson Johnson conllevaba una sola inyección. Ciertamente lamentamos que algunos de ustedes que puedan haber tenido citas para el día de hoy hayan tenido inconvenientes. Pero esto no nos impedirá trabajar enérgicamente para vacunar a todos los residentes de Filadelfia. Las clínicas que tuvieron que cerrar debido a esto cambiarán rápidamente a otras vacunas y volverán a abrir lo antes posible. Y con esto en mente, me complace anunciar que esta semana nuestras clínicas alcanzaron un gran hito en nuestro primer 1.000.000 de dosis de vacunas administradas. Administramos la primera vacuna a fines de diciembre y desde entonces hemos visto a la ciudad y a nuestros socios comunitarios de atención médica unirse como nunca antes. Me gustaría agradecerle al Dr. Farley y a su gran equipo en el Departamento de Salud, así como al gerente y la gente de la Oficina del Manejo de Emergencias, dirigida por el comisionado de bomberos Adam Teal. Este hito también se comparte con FEMA y con nuestros socios estatales de PIMA y con el Departamento de Salud de Pensilvania y con nuestros socios comunitarios y de atención médica por su trabajo incansable durante el año pasado. 1 millón de dosis en solo 4 meses y medio es algo significativo y todos merecen recibir el crédito y el reconocimiento, porque Filadelfia es una ciudad de asociaciones y es así como hacemos las cosas, trabajando juntos. Por supuesto, a partir del próximo día, lunes 19 de abril, todos los habitantes de Filadelfia serán elegibles para recibir la vacuna. Aún no hemos terminado y no nos detendremos hasta que todos en Filadelfia que quieran recibir la vacuna puedan recibirla. Pero para eso necesitamos tu ayuda. Así que ayuda a correr la voz sobre la importancia de vacunarse con tu familia, con tus amigos y con tus vecinos. Gracias. Y estas son las palabras del comisionado de la salud, el Dr. Thomas Farley, para el día 13 de abril del 2021. Hemos decidido detener el uso de la vacuna de Johnson Johnson. Este tema lo discutiremos más adelante, sobre todo por sus implicaciones para Filadelfia. Y el recuento de los casos continúa aumentando. Es necesario vacunar ahora a la mayor cantidad de personas posibles mayores de 65 años para evitar más muertes. Y comenzamos con los números del día de hoy. Tenemos 130 nuevos casos confirmados por la prueba PCR y la prueba de antígenos reportados hasta el día de ayer, con un total de 130.117 casos. Queremos destacar que hemos recibido un número muy bajo de resultados de las pruebas de laboratorio, unas 5.500 en total. Para la semana pasada, del 4 al 11 de abril, el promedio hasta el momento es de 511 casos diarios, con un 6,7% de pruebas positivas. Estos números son similares a los de la semana previa, del 28 de marzo al 3 de abril, donde el promedio fue de 562 casos por día. Los casos han estado estables en los Estados Unidos, pero con un incremento localizado en algunas áreas, incluyendo Michigan, donde el director de los Centros de Control de Enfermedades recomendó el cierre de la ciudad. Con respecto a los pacientes hospitalizados, para el día de ayer, lunes 5 de abril, 454 pacientes con COVID-19 están internados en los hospitales de Filadelfia. Estos pacientes están en una condición estable. En cuanto a los fallecimientos, para el día de hoy se identificaron 5 muertes por el COVID-19 con un total de 3.341 fallecimientos. Se reportaron entre 20 y 30 muertes semanales a fines de febrero y marzo, 34 muertes por semana durante la semana del 28 de marzo. Desafortunadamente, esperamos un aumento en las próximas semanas. Con respecto a la vacuna de Johnson Johnson, hay 6 casos que se han reportado con problemas de coagulación de la sangre. Esto es algo raro, pero es algo serio. La reacción son los coágulos de sangre combinados con recuentos bajos de plaquetas. Estos casos se han producido en mujeres de 18 a 48 años de edad. La FDA y los Centros de Control de Enfermedades recomiendan pausar el uso de la vacuna de Johnson Johnson hasta que se investigue más. Nosotros seguiremos con estas instrucciones. No se administrará la vacuna de Johnson Johnson en Filadelfia con vigencia inmediata hasta nuevo aviso. Hay que poner todo esto en perspectiva. Esto es algo extraordinariamente raro. 6 casos entre 6,8 millones de dosis administradas en los Estados Unidos. Esto es aproximadamente un caso por cada millón de dosis. El riesgo es 1000 veces menor que el riesgo de infección de contraer el COVID-19. La ciudad de Filadelfia tiene 1,2 millones de adultos y ya hay 3.300 muertes por el COVID-19. Así que podemos afirmar que cualquier persona es mucho más propensa a tener complicaciones médicas por el COVID que por la vacuna de Johnson Johnson. Así que no hay razón para pensar que este problema esté relacionado con otras vacunas, como la de Pfizer o la de Moderna. La tecnología es diferente. Utiliza el ARN en contra del vector del adenovirus. Las vacunas de ARN son mucho más simples y más puras. Hay 190 millones de dosis que han sido administradas en los Estados Unidos ya, sin que se observe este problema. Tenemos nosotros asignada para su entrega esta semana aproximadamente 40.000 primeras dosis de la vacuna de Pfizer y la de Moderna, más una cantidad similar de segundas dosis con un total de 80.000 dosis. Nos dijeron que tendremos aproximadamente el mismo suministro de vacunas durante las próximas 3 semanas. Así que tenemos el suficiente suministro para continuar con la mayoría de los servicios de vacunación. ¿Cómo se encuentra disponible la vacuna en la actualidad? Tenemos ahora 261 sitios inscritos que están recibiendo vacunas. Los hospitales, las clínicas comunitarias y las farmacias están funcionando como centros de vacunación. Ahora tenemos 46 farmacias independientes que están administrando las vacunas. En cuanto a la vacunación en el centro de vacunación de Center City, en el centro de convenciones de Pensilvania, Ayer se terminó de distribuir la segunda dosis de la vacuna de Pfizer. Anteriormente, planeábamos cambiar de Pfizer a la de Johnson Johnson el día de hoy. En vez de hacerlo, continuaremos con la administración de las primeras dosis de la vacuna de Pfizer a partir del día de hoy, desde el mediodía hasta las 4 de la tarde. Y vamos a solicitar una extensión de 4 semanas para el personal federal, para un total de 6 semanas a partir del día de hoy, 3 semanas para la primera dosis y 3 semanas para la segunda dosis. Con respecto acerca del centro de vacunación tipo 2 de FEMA, se vacunaron aproximadamente 2,000 personas por día durante el fin de semana y fueron 1,100 personas que se vacunaron el día de ayer. El grupo fue muy diverso, solo un aproximadamente 15% de blancos en contraste con un 55% de hispanos. En este centro se había estado usando la vacuna de Johnson Johnson y se había planeado cambiar a Pfizer el día sábado. Ese centro cerrará el día de hoy y se reprogramarán a los pacientes y se cambiará a la vacuna de Pfizer el día de mañana. 3 semanas para la administración de las primeras dosis, 3 semanas para la administración de las segundas dosis. Al menos 1,000 dosis por día se planean administrar allí. El horario de atención de mañana es del mediodía hasta las 8 de la noche. Nosotros vamos a tener que reducir algunas clínicas específicas donde planeábamos administrar la vacuna de Johnson Johnson hasta que podamos reprogramarlas. Por ejemplo, las clínicas que operan en el Departamento de Bomberos y en la Oficina del Manejo de Emergencias. Y vamos a realizar algunas clínicas emergentes. Con respecto a la administración de las vacunas, el proceso de vacunación en Filadelfia está sucediendo rápidamente. La semana que finalizó el día 4 de abril, administramos 119,000 dosis de la vacuna. La semana que finalizó el día 11 de abril, teníamos aproximadamente 120,000 dosis administradas, pero estos datos aún están incompletos. Este incremento ha sido en casi todos los proveedores de vacunación, pero particularmente en las farmacias, que es nuestra fuente principal. Para el lunes en la tarde, 612,000 personas habían recibido ya la primera dosis de la vacuna y 398,000 personas estaban completamente vacunadas. Hoy llegaremos al 1,000,000 de dosis administradas. Sabemos que el 27% de los residentes de Filadelfia han recibido al menos la primera dosis y el 17,5% están ya completamente vacunados, de acuerdo a nuestros datos. De acuerdo a los datos de los Centros de Control de Enfermedades, el 20,8% de los residentes de Filadelfia están ya completamente vacunados, pues estos datos incluyen los residentes vacunados en otros lugares. Un 45% de los residentes mayores de 65 años de edad están ya completamente vacunados, de acuerdo a los datos de los Centros de Control de Enfermedades. Así que nosotros tenemos que aumentar la vacunación en aquellos mayores de 65 años de edad para prevenir más muertes. Con respecto a la elegibilidad, ayer en Filadelfia, todas las personas en la fase 1C ya son elegibles. Esto incluye a las personas mayores de 65 años de edad, aquellas personas con condiciones médicas de alto riesgo, a los trabajadores esenciales, a los cuidadores no remunerados y a las personas que reciben servicios basados en el hogar y en la comunidad. La Mancomunidad de Pensilvania pasa hoy a la fase 2 y Filadelfia pasará a la fase 2 el día 18 de abril. Esto es congruente con la solicitud que nos ha hecho el presidente. Nosotros vamos a permitir que las personas mayores de 65 años de edad continúen teniendo prioridad. Si usted aún no es elegible, pero está ansioso para vacunarse, comience a programar su cita para la próxima semana. En cuanto a la vacunación de personas mayores de 65 años de edad, el mensaje para los residentes de Filadelfia, si usted tiene más de 65 años de edad, es que por favor se registre ahora y pueda vacunarse lo antes posible. Por favor, no se demore. Nosotros estamos ofreciendo acceso directo a las vacunas. Hay muchos centros de salud federalmente calificados que están ofreciendo vacunación sin cita a aquellos mayores de 65 años de edad, aun si estas personas no son pacientes de estos centros. Hay 3 centros de salud en la ciudad que están vacunando a los mayores de 65 años de edad los días miércoles de 8 de la mañana a 4 de la tarde utilizando la vacuna de Moderna. El Centro de Salud 3 en el anexo en la calle 4219 de la avenida Chester en el oeste de Filadelfia. El Centro de Salud anexo 5 en el 2001 oeste de la calle Burks en el norte de Filadelfia. El anexo de salud 10 en el 2230 de la calle Codman, el lado oeste, en el noreste de Filadelfia. La semana pasada, aproximadamente 200 personas mayores de 65 años se vacunaron en estos centros. ¿Qué deben hacer las personas que quieran vacunarse? Primero, registrar su interés en fila.gov/vaccine interest. Si usted no tiene internet, llame al 311 y le ayudarán con el registro, y puede hacerlo en español. Hay farmacias, hospitales y clínicas que tienen sus propias páginas web para hacer su cita y así poder vacunarse. En cuanto al transporte para las clínicas de vacunación masiva, los centros de Center City y de Esperanza son accesibles por el transporte público. Hay un servicio CCT gratuito para los mayores de 65 años de edad o aquellos ciudadanos que tengan discapacidades. Para solicitar este servicio, debe llamar al 311, seleccionar la opción 5, y esto tiene que hacerse al menos 72 horas antes de acudir a la clínica. La ciudad ayuda a las organizaciones comunitarias a coordinar los autobuses de enlace comunitarios. Si usted pertenece a alguna organización comunitaria y necesita transporte grupal, puede usted enviar un correo a oem@fila.gov. En cuanto al acceso al sitio de Esperanza, es accesible por las rutas de los autobuses 47 y 53, por la línea de metro de Broad Street en las paradas de Hunting Park o Allegheny, por el servicio de transporte express gratuito desde Allegheny que operará continuamente durante el horario de atención de esta clínica. Hay detalles adicionales en nuestra nota de prensa y un recordatorio. La epidemia sigue aquí, sigue creciendo y sigue siendo mortal. Por favor, no se confunda, porque todo esto aún no ha terminado. Así que, por favor, utilice su mascarilla, mantenga la distancia social, evite estar cerca de otras personas y tan pronto como sea su turno, vacúnese. Solo con nuestro esfuerzo conjunto podremos superar esta pandemia. Muchas gracias.
Thank you, Armando. We are now going to move to the Q&A portion for members of the press. And today, as usual, we are pleased to be joined by Managing Director Tumar Alexander. Because of limited time, only one representative from each media outlet is permitted to ask questions for the first round. And we are asking reporters to limit their questions today to 3 or fewer. The first round is limited to the topic of COVID-19. And if there is time, we will do a second round on other topics. Let's start off now with Mitch Blocker of NBC 10.
Thank you. Good afternoon, everybody. Dr. Farley, have there been any J&J complications in the city of Philadelphia that you are aware of? And can you describe what the Department of Health is doing to find out?
We're not aware of any. There is a system for reporting of adverse events that mainly goes to the federal government, but that we will likely get reports as well. If any provider sees somebody that they have some reason to think it might be any sort of adverse event, not just these were diagnosed here. So it is possible in the wake of this publicity there will be some cases that were uncovered that were not previously recognized, but so far we don't know of any.
And I know I ask you for your projections almost weekly at this point, but I'm curious for an updated one. How does losing the J&J vaccine change the timetable for widespread vaccination in Philly?
I don't think it changes it that much. Johnson & Johnson was a pretty small fraction of the total doses we were delivering. As you know, we were already dealing with a shortage of Johnson & Johnson vaccine. Fortunately, we have these other 2 vaccines that are excellent vaccines. And fortunately, there's some level of protection even with that first dose. So this is a setback, but I would consider it to be a small setback and an overall program that is very successful.
So end of June still?
Yes, end of June still.
And one last question. I'm just curious how you manage potential vaccine hesitancy that may arise from people who now see a vaccine that has had a misstep.
That's part of why I'm really trying to communicate how low the risk potentially is with the Johnson & Johnson vaccine and how that's totally different from these other 2 vaccines. And these other 2 vaccines, already have been given to 190 million people in this country. That's an extraordinary track record, and I think we should all feel very comfortable with those other vaccines.
Thank you, sir.
Thank you, Mitch. Let's go now to Isabel Sanchez of Telemundo.
¿Qué tal? Buenas tardes, Armando. Mi pregunta es para el doctor Farley. Hablando específicamente de esa duda o esa tal vez desconfianza que existe todavía dentro de comunidades hispanas y que estaba presente incluso antes de que esta noticia saliera sobre la vacuna de Johnson & Johnson. Mi pregunta es, ¿qué estará haciendo la ciudad para ayudar a lidiar con esa duda que pueden sentir algunas personas y que ya sentían antes de comunidades como las comunidades hispanas sobre vacunarse?
Question is for Dr. Farley. Dr. Farley, there's been doubt and mistrust in the Hispanic community even before this issue with the Johnson & Johnson vaccine and the news about it. So what will be the city doing, and what would be the city helping in order to alleviate these doubts that existed before this issue with the Johnson & Johnson vaccine?
Well, I really think it's really about communicating to people, communicating the risks of not getting vaccinated and the safety of the vaccines that we have and are continuing to operate. And that's communicating both through the press, to individual people, and also with community leaders. As I said before, we've had over 3,000 deaths in Philadelphia now. That's an extraordinarily high risk of death if you don't get vaccinated. And we have an extraordinarily good track record with the vaccines that we are giving. So I still think this is far and away the right decision to be vaccinated. And I think people, when they hear all the facts and know that we're being totally honest about this, they'll make the same conclusion.
Obviamente, la respuesta pasa por la comunicación. Nosotros tenemos que dejarle saber a la gente sobre los riesgos de no vacunarse y ver también los riesgos que implica la vacuna. Pero podemos hacerlo a través de las ruedas de prensa, a través de contacto con la gente y los líderes comunitarios. Ha habido más de 3,000 muertes por el COVID-19 en Filadelfia y el riesgo de no vacunarse es aún mayor que el que vacúnense. Por eso nosotros tenemos buenos resultados con las vacunas que hemos usado y de lejos es importante vacunarse y que la gente se arme de hechos e información correcta para disipar estas dudas. Gracias.
Armando, mi segunda pregunta sería sobre su mensaje para aquellas personas que recibieron la de Johnson & Johnson, que se sienten ahora atemorizadas o que tienen dudas acerca de ser vacunados. ¿Cuál es el mensaje por parte del Departamento de Salud para aquellos que ya la recibieron?
Dr. Farley, the second question is also for you. This is in regards to the doubts that those people that have already been vaccinated with the Johnson & Johnson vaccine may have. What message would you have for them?
Now, the adverse events that have been seen happen in the first 2 weeks after vaccination. And so if you're more than 2 weeks out, you probably don't have anything to worry about. If it's right afterwards, the symptoms that you might want to look out for are a severe headache, not the typical headache you get the next day after vaccine, but severe headache, severe abdominal pain, severe leg pain, or shortness of breath. If those happen, you can go to see a doctor. But again, the risk is extremely low here. We're talking 1 in a million. That's about the risk of dying from being struck by lightning. So most people should just relax that they still made the right decision to get vaccinated.
Obviamente, lo que les tenemos que decir a estas personas tiene que ver con los riesgos adversos que presenta esa vacuna. Y sabemos de que los síntomas se presentan durante las 2 primeras semanas principalmente. Por lo tanto, si han pasado ya más de esas 2 semanas, no tienen nada de qué preocuparse. Los síntomas a los cuales tienen que estar alertas son dolores de cabeza graves y severos, no los dolores de cabeza relativamente normales o los que se experimentaron al iniciarse la vacunación. Dolor abdominal, dificultad para respirar, y si tienen estos síntomas debieran contactar a su doctor, teniendo en cuenta y recordando de que estamos hablando de un caso por cada 1,000,000 de vacunaciones. Por lo tanto, tienen el mismo riesgo a ser fulminados por un rayo, a tener efectos adversos a raíz de la vacuna de Johnson & Johnson. No hay que temer, pero hay que permanecer vigilantes. Gracias.
Armando, una última pregunta entonces de nuevo para el doctor Farley, para aclarar y confirmar. ¿Esta nueva noticia con Johnson & Johnson no retrasaría entonces la meta de abrir las vacunas para todos el 19 de abril?
One final question for Dr. Farley as well. This news about the Johnson & Johnson matter, wouldn't those delay the plans of the city to open up vaccination for everyone in the city by April 19th?
No, we will still make everyone eligible on April 19th.
No, todavía vamos a hacer que todos sean elegibles y puedan acceder a la vacuna para esa fecha. Gracias.
Thank you.
Thank you, Isabel. Let's go now to Annie McCormick of 6ABC.
Hi, this question is for Dr. Farley. Just a little clarification. Yesterday, I was with the FEMA folks at the convention center, and they had said that they were stopping Moderna and Pfizer and moving strictly to Johnson & Johnson starting Wednesday. So how is that going to still make it able for you to open up April 19th to a larger population if that's one of the main sites? I mean, maybe I'm misunderstanding something, but I'm just kind of wondering with the allotment, if Johnson & Johnson is only a small amount of what the city has, how is that going to work out?
So there were doses of Johnson & Johnson set aside specifically for that site. and we were just about to change over to them, but instead we will just continue to use Pfizer vaccine. And we do have Pfizer vaccine in storage in various sites around the city. We're hopeful we may receive additional Pfizer vaccine from the federal government. So we'll be able to keep that site open, but just with Pfizer vaccine.
So how much do you have at this point of Moderna and Pfizer to get you through vaccinating at the FEMA site, the convention center? Or because it's a FEMA site, do you have a little bit more leeway because you're dealing with the federal government and this is a nationwide issue?
Yeah, so, we get a total of about 80,000 doses of Pfizer, Moderna combined. So I guess about 40,000 doses of Pfizer each week. But, there's been a period of time here where we've had more Pfizer coming into the city than we've been able to administer each week. Pfizer is the one that needs ultra cold storage, and so it's the most difficult to use. And so there is Pfizer in storage in various places, some in the health department, some in other hospitals around the city. We can certainly get started that clinic with the Pfizer we have in storage. And as I said, we're talking to the federal government about, with the potential loss of the Johnson & Johnson vaccine, can we get additional Pfizer? We're hopeful that we can. And so we intend to just try to continue as much as we can at the same rate of vaccinations per day, but just with a different vaccine.
And just with that said, last question, what was this morning like for you? I mean, did you have to have emergency meetings with those healthcare systems that have the extra Pfizer and Moderna that you may need to tap into? What was your morning like as far as dealing with this? Was it a critical moment where, kind of an emergency in a sense?
Well, we've been working very closely together, the healthcare providers in the city and the federal government and the state for many months now. And so we've got, we're all on speed dial and all on email chains. And so we heard around 7:30 this morning, the federal government recommendation. Within about half an hour, that information was really known to most of the providers across the city. And everybody agreed that we need to follow federal guidance. And then within another couple of hours, we had clearly fallback plans for our sites. So it worked out quite well. It is a setback, but as I said, we do have lots of other things going for us that enable us to continue.
Great, thank you.
Thank you, Annie. Let's go to David Murrell of Philadelphia Magazine.
Yeah, hi. I just have a couple of points of clarification about the walk-ups at the two FEMA clinics. I'm wondering who's eligible at present for walk-ups at the convention center and the Esperanza site, if it's as before under vaccinated zip code scenario, and also if there's like a breakdown of, a certain portion of appointments that are reserved for pre-scheduled and some for walk-ups, or how that's being handled.
Yeah, the way that we were doing it, and it may change a little bit with the change in Pfizer, is that we were scheduling 5,000 people and then enabling people to walk up as well. And we know when we schedule 5,000 people, not all of those people actually come. And so there's opportunities for maybe a couple thousand people to walk up. And our eligibility for walk-ups was not a zip code specific. It could be any Philadelphia resident who met the eligibility criteria under 1C. And as of Monday, it'll be any Philadelphia resident, period.
Okay, so that's 5,000 across the two clinics combined.
No, that's just for the convention center. For Esperanza, they're scheduling about 700 appointments a day, and then allowing walk-ons on top of that. Okay.
And then just my final question, I'm interested to know, especially given that there will be sort of more 2-dose shots being given, in the future due to the Johnson & Johnson circumstances. Has there been a problem with people not getting their second doses for the Pfizer and Moderna shots? And, if so, what percentage of those who received the first dose are not getting the second one?
I don't have the numbers, that there are some people. Let me say that the take-up for second doses is very high compared to other, medications or things which require multiple visits. It's not 100%. It's over 90%, but I don't have the exact number. And so, we've been communicating to people that they can still come in, say, to the convention center, even if they weren't scheduled that day, if it's around the time of their second dose, so that they can just drop in and we'll give them their second dose. And we're going to continue to communicate to people and try to get that, as close to 100% as we can.
Okay, thanks. That's all I've got.
Great, thank you, David. Let's go to Jason Laughlin of the Inquirer. Jason, you'll have to unmute yourself there if you could. Jason, you want to try that again? Could you unmute?
Can you hear me?
Yep, go ahead.
Sorry about that, Dr. Farley. A couple questions. You were just talking about walk-ups. Could you say if having to rely on Pfizer, which has sort of the more rigid kind of storage requirements, is that going to affect your ability to do walk-ups? Does it take away some of your flexibility?
We were going to simplify things with going to the Johnson & Johnson vaccine because there's scheduling involved with the Pfizer vaccine, and there isn't scheduling involved for the Johnson & Johnson vaccine. But we've been using the Pfizer vaccine for 6 weeks now. We know how to do it. We'll just continue the same staffing we had before rather than reduce the staffing.
In regards to some of the kind of the homeless population and transient people in the city, can you talk about how this is affecting mobile sites and how many people in the homeless population got the J&J, and has anyone experienced any complications from that?
So we don't know of any of these complications having occurred in the city in anyone who received Johnson & Johnson vaccine. We were trying to reserve the Johnson & Johnson vaccine for people that might have difficulty coming back for 2 doses. So someone who was homeless on the street or someone who was homebound, couldn't come in. So we're trying to reuse that for. It will make it more complicated to reach those people for 2 doses. We will have to adjust. Now, we're told by the federal government that this pause may be only a matter of days. And if so, then we can get back and we'll continue to vaccinate those people with Johnson & Johnson. If not, we'll do the best we can with one of the 2-dose vaccines.
And last questions on the FEMA sites, the Convention Center and Esperanza. At the Convention Center, are you absolutely committed to doing Pfizer for the duration of that clinic? Or if in a couple of days the federal government says, yeah, you can go back to J&J, would you do that?
I would just have to make that decision when we know more from the federal government. Because we don't know whether they'll just say, go ahead, start using it, or they would say, use it with restrictions. So it would really depend very much on what they say. I can say that we're committed to doing operations at that site and vaccinate as many people as we can there.
And lastly, in regards, again, the Esperanza site, how much is this going to reduce the number of people you were hoping to be able to vaccinate there? When you were initially going in with a 1-dose treatment, now you have people that are going to have to do 2 doses. How significantly does that reduce the reach of that site?
Well, on that site, we always plan to start out with Johnson & Johnson and then switch to Pfizer and do 6 weeks of Pfizer. So this means we're switching a few days earlier. So I don't think it's going to make a big difference. Now on the far end, after we finish those 6 weeks, we need to figure what to do at that point. But I hope by then we have a better sense of the Johnson & Johnson vaccine and how it might be used or whether it's still going to be used, and we'll deal with that at that point.
Okay, thanks very much.
Thank you, Jason. Let's go now to Jack Tomzik of the Metro.
Thanks. This is for Dr. Farley. Do you have any idea how many appointments have had to be canceled today because of this?
I don't. It would be in the hundreds, but we have staff there meeting people who come in and communicating people who have appointments. They're not just being canceled, they're being rescheduled. And there's plenty of scheduling opportunities. So it's our goal to reschedule everybody who had an appointment today.
And you said you asked the federal government to stay around for those second doses. Have they responded to you? And do you feel comfortable moving forward with the first doses, even if they say we're not staying at the convention center?
We're in close communication. We don't have a final word on this, but I'm optimistic that things are going to work out well there.
All right. Thank you.
Thank you, Jack. Let's go to Martin Pratt of Philly YBN.
Dr. Farley, can you reiterate how churches would get in contact to have the shuttle bus? What was the email address?
Yeah, if a church wants to have a shuttle bus to bring people down to the convention center or Esperanza, that's great. They should send an email to oem@phila.gov. OEM stands for Office of Emergency Management, oem@phila.gov. And we'll help coordinate that shuttle bus arrangement.
Thank you. Second question, based on what you know has been one of the challenges in getting folks to really feel comfortable taking a vaccine, particularly Black and Hispanic communities or Latinx communities, has your office considered doing a special town hall to discuss after the government gets back to you, the feds get back to you about Johnson & Johnson, because we know that we won't reach total vaccination because we're getting to that 20%, that last 20%. So with this hiccup or this roadblock or stumbling block, has there been any discussion about any way to reach out to the community and explain what this means?
We've had lots of town halls throughout the entire epidemic, and particularly during this period when we're vaccinating people. And we'll, I'm sure, continue to do lots of town halls and various forums where we discuss where we are and answer people's questions. I think that really is essential for us to do this. And for community leaders, or say, church leaders in particular, are much more in communication with the folks who want to vaccinate than we are. And so it's really important for them to really have their questions answered. So yes, we will continue to do that, but it wouldn't be one event. It's sort of a continuous conversation.
Okay, thank you. I'm done.
Thank you, Martin. Let's go now to David Melandra of Philly Sports Network.
My question is for Dr. Farley. First off, since the sports fans have been allowed back into Citizens Bank Park and the Wells Fargo Center, and with the cases just recently rising, has any of the contact tracing resulted in from the fans being back in the stadium?
Our contact tracing is very limited these days because the vaccination effort has needed a lot of staffing. So most of our contact tracers have been redeployed to work on the vaccination effort. I think we don't know whether spread might have occurred at the sports stadiums. I did receive a complaint with some photos of Citizens Bank Park of fans sitting there without masks. I wasn't happy about that. And so we're communicating to the Phillies that they're really going to need to enforce mask use there. We don't want spread occurring at any of these events.
A couple weeks ago, there was a report that came out from the NFL that NFL Commissioner Roger Goodell said that he hopes by some point during the 2021 season that there will be full stadiums during the season. What are your thoughts about that?
It's just far too early to tell where we're going to be in the fall. This has been a long epidemic, but it isn't over yet. There's got many or more twists and turns and surprises. So no one can make predictions of where we're going to be in the fall.
And last one for me, there a couple weeks ago, there was a report that came out that certain venues like the Wells Fargo Center and other places are hoping by in the fall to host large concerts and have built stadiums. Do you think that's really realistic at this point, or do you think at maybe 2022 you think there'll be large concerts allowed back in?
Yeah, I'm not going to make any predictions for the fall for that venue either. It's just too many unknowns.
All right, thank you.
Thank you, David. Let's go now to Pat Loeb of KYW.
Dr. Farley, how many J&J doses were administered in the city?
Well, and it's on our website, but I think it's in the order of 20,000. It's pretty small compared to our other vaccines.
Thank you. That's it.
Okay, we are about 6 minutes left. We're going to go to a second round of questions, and Manny Smith of CBS 3, I believe you had signaled that you wanted some questions.
Yeah, I do have a few questions today. I think all of them are for the mayor for the most part. First one, Mayor, is I know the school district unveiled their plan for returning students to school, and it kind of sounds like that, hey, the seniors who have been out for a year and a half, the class of 2021, won't ever have a chance to return to formal instruction at their schools. Any message for them, and is the city planning to do anything special for them to honor them in a different way?
Don't have anything special planned at this moment. Certainly we can think about what we could do for them. What I would say to them is I'm really sorry. I know this has affected your life, and hopefully you can look back and believe that the sacrifice you made helped people to get better and not get sick. And that, I'm sure there were situations back in other crises in the country, World War II and others, where people's lives were interrupted. And I really feel bad about it, but I'm happy that they're safe and healthy.
We've been working on some reporting this week saying, hey, the city proactively has been working with business owners in case there may be some more potential civil unrest in the wake of the Chauvin trial. We hear that the city has developed a red, yellow, green warning system for businesses. Can you comment on that and maybe talk about other proactive measures you might be taking?
Well, certainly we're talking and planning, and hopefully the case will go the way it should go. I mean, obviously I've been We've all been watching the case, and it's very clear what happened to Mr. Floyd and how it should have never happened. So we're hoping that justice will be done. But as we've seen in this country's history, sometimes justice does not get done. So we're planning for people's reactions and the effect that happens. I'm not going to get into specifics at the moment on the red, yellow, green, but we are planning, talking regularly, dealing with our Commerce Department, Police Department, our community partners, the clergy, labor unions, to kind of make sure that if it does go sideways, which we hope it doesn't, that we won't tear ourselves up again as we did in May and June.
Within the past hour, FOP President John McNesby put up a short statement. I'll read it right from him to get your reaction. It says, quote, "As we prepare for the potential for more civil unrest in our city, remember that we have sworn to protect and serve, but do not let yourself become a sacrificial lamb to those who will perceive your actions for political gain. Stay safe."
I don't know what that means, so I'd have to.
Sounds like he's messaging at the police officers, I guess, telling them not to become a sacrificial lamb out there.
I don't know what a sacrificial lamb means, and I'd have to talk to Mr. McNesby to find out what his intent was. All I do know is that our police officers work hard every single day, putting their lives in jeopardy and putting themselves between harm's way and us, putting themselves in harm's way. And I know they will do their duty as they did back in the other periods of time we had this. So I don't really have any comment on his statement or his tweet or his text because I really don't know what it means.
All right. Thank you very much.
All right, let's go quickly. Brian McCrone of NBC 10. We have time for just a quick question from you, and then we'll go to Martin Pratt.
Yeah, Dr. Farley, it's like, what would you say to the people who are concerned about the 1 in a million possibility of death combined with the lower efficacy rate of J&J? In other words, like, do you anticipate many people saying they're going to wait for the Pfizer or Moderna vaccine, considering it's a considerably lower efficacy rate? And I'm not just talking about, I understand that death and hospitalization is one thing, but still, I mean, if you still have maybe a 1/3 chance better of getting COVID overall than if you were to just wait for the Pfizer or Moderna. What's your plans for people doing that?
I'm not quite sure I understand the question, but for people who haven't been vaccinated yet, we've got 2 other excellent vaccines and very, very, very safe vaccines that people can be vaccinated with. I would strongly recommend anybody who's not vaccinated yet, come in and get vaccinated. For those people who are already vaccinated with the Johnson vaccine, you're doing great. And this complication, if it's connected to the vaccine at all, and extraordinarily rare. And so I still think you made the right decision. You're going to be protecting yourself from COVID, which is pretty common these days.
All right. Thank you, Brian. Let's go finally to Martin Pratt. Let's go back to Martin for a quick follow-up.
Okay, sorry. Dr. Farley, has the health department decided or thought about, as cases ramp up, what additional things you will do to try to track hotspots within the city? Like, a lot of cities are starting to look at the wastewater tracking and being able to immediately go to an area where COVID seems to pop up, getting ahead of it by using the wastewater tracking.
Yeah, so the wastewater tracking is being done in Philadelphia. It's more of a research tool than it is something which we're using for response. And it's not going to tell you a particular neighborhood that's hotter than another neighborhood. I haven't looked at it for some time, but I looked at it in the past. It broadly correlated with the level of disease activity that we see in the city. We have lots of other measures of disease activity in the city to go on. And so we're going to continue to go that. So it wouldn't, for example, tell you whether spread is occurring in restaurants or sports stadiums or private homes or other things like that. It's more of a research tool. We'll use the existing data sources we have to determine what sort of restrictions, if any, make sense to put in place.
Very good. Thank you, Martin, and thank you, Dr. Farley. And with that, we are out of time. We do anticipate that Dr. Farley will have a further press briefing on Friday, details on that to follow. And the mayor and managing director and Dr. Farley will be back next Tuesday on April 20th. Thank you.